And good afternoon and happy Friday to you. I'm Scott Swan. We want to take you over to the State House this afternoon to hear from Governor Eric Holcomb. This is our first Friday of the stay-at-home order, and we hope to get an update from the governor and the state health commissioner on how we are doing in stopping the spread of the coronavirus. One of the highlights that we're going to hear today, hopefully, is about testing. And unfortunately, the death toll has gone up across our state. We now have 24 deaths here in Indiana as a result of COVID-19. So let's go out to the State House and listen to the governor.
Process. Also on Monday, after a lot of thought and careful evaluation, we'll be going to virtual press conferences. Same time, 2:30. Tuesday, Wednesday, Thursday, Friday, potentially on Saturday and Sunday as well. Trustee Press Secretary has convinced me that this will open it up even further to a statewide press tour, and we'll still be taking questions live, and we'll still be updating Hoosiers on a daily basis on numbers, on policy updates, and the ramifications of both. And toward that end, I'd ask that the Commissioner of the Department of Health, Dr. Chris Bonsu, no longer needs an introduction. Statewide, if you could talk about some of our recent numbers and give an update on our supply chain. Appreciate it.
Thank you, Governor. I do have the numbers with me. I wasn't planning on giving them directly, but I'm happy to if you want them. I know you've already seen those numbers. You see our updates every day at 10 a.m. on the website. We post those for you guys. I want to send my deepest sympathies to the 7 new individuals that we had to post, to their families, their communities, their friends, for their loss. And I want you to know that we are doing everything we can every day to decrease the risk that more Hoosier families and communities will experience these type of losses. A big part of that work involves our efforts, as you know, in long-term care facilities across the state. And as I said yesterday, no state is going to get through this pandemic without having outbreaks in our long-term care facilities. We're dealing with that scenario now, as I know you're aware. But from day one, our top priority has been our highest risk individuals, including those that live in long-term care facilities, rehab facilities, and residential facilities. We've been providing guidelines to facilities about infection control and other protocols that they can use to help lower the risk to the individuals that live there. We've also, by the end of today, our nurse surveyors will have been to all 535 nursing homes and all 202 freestanding facilities in the state of Indiana to help them prepare by sharing guidance and checklists and by reviewing their plan for COVID-19 action. This has been a huge undertaking, and that's been critically important so that they know that we are engaged and we're interested and they have someone that they can contact and how to reach us. We're trying to make sure that all of our older residents are being protected, especially those with underlying medical conditions, from being severely impacted by COVID-19. We're also working with our long-term care facilities, hospitals, our local health departments, the Indiana Hospital Association, and the Association for Long-Term Care Facilities to ensure that we have a plan for how residents of these facilities who test positive for COVID-19 in all areas of our state can be cared for. As you saw with this morning's update, we continue to see a large increase in the numbers of tests reported to ISDH. Today, we reported nearly 2,300 new test results just in the past 24 hours, and that was our highest number to date. We are working to further expand testing in the state of Indiana, and we hope to have additional in-state labs on board in the next coming weeks. Finally, I know that there's been a lot of requests for additional data, and today we did enhance our dashboard at www.coronavirus.in.gov to include age ranges and gender breakdown of the individuals who have tested positive, and we'll be updating that on a daily basis. We will continue to gather and analyze more data and post more data for you to be able to see in the coming days and weeks. Thank you.
Thank you, Dr. Box. Next, I'd like to, we took a question yesterday that I thought really got at the heart of this, and is this approach that we're taking working. And I've asked our Commissioner of the Department of Transportation, Joe Mcginnis, to provide a little evidence that it is working. And if you could do that, Joe, would appreciate it.
Well, good afternoon. Thank you, Governor Holcomb. As he mentioned, my name is Joe Mcginnis, the Commissioner of the Indiana Department of Transportation. First of all, I'd like to let all Hoosiers know that INDOT is continuing to maintain Indiana's highways for essential travel as we respond to the COVID-19 emergency. We know how important it is for critical medical supplies to reach care providers and for essential items to reach groceries and supermarkets across the state. Our freight network plays a vital role in meeting all of those needs, not only here in Indiana, but across the entire country. To our men and women that are working right now on Indiana's highways, from deep down inside of me, thank you so much for continuing to work hard for all Hoosiers. At the same time, I want to make sure that all Hoosiers help us preserve the health and the safety of all of our employees. If you must travel for essential reasons, please pay attention, put your phone down. And as you are approaching a construction zone, please move over and slow down. As was reported yesterday, we actually had 3 INDOT employees that were struck on a job site along I-70. Thankfully, I'm happy to report today that they have been treated and released from the hospital and are on their road to recovery. In addition to highway maintenance, our employees have been working hard alongside the Indiana National Guard, Indiana State Police, and the Indiana Department of Health to transport personal protective equipment and medical supplies to hospitals and healthcare facilities around the state. We're proud to help in all efforts to fight back. Our construction program for 2020 is moving forward on schedule. Again, this year, we will build more than 1,000 projects around the state. And you're likely to see more and more orange barrels pop up around. Continue to work with our contractors and our maintenance teams to practice social distancing while we advance the work plan for this year. For the long term, we are watching the changes in traffic and fuel purchasing very closely. We know that we'll have an impact on revenue for road maintenance and construction for INDOT and for local communities. In fact, we have been collecting traffic volume data each day, comparing it to the week of March 2nd through the 8th. Thursday, yesterday, March 26th, we saw a reduction of 41% of all combined vehicle traffic. That includes 45% reduction in light vehicles on our state highways. Those are the sedans and minivans and passenger vehicles. As Chris Johnson mentioned yesterday on statewide level, we know this emergency will impact revenue coming into the state. Road maintenance and construction is not immune to that, but we are monitoring the situation closely. And we will use our funding available as efficiently and effectively as possible to make sure we are delivering our mission to keep our transportation safe and in good condition. We will also work closely with our federal partners at United States Department of Transportation to make sure we are maximizing any federal dollars and resources that may be available to transportation as we manage this over the long term. Finally, I'll just offer a reminder. For those of you that must travel, if you have questions or concerns for INDOT, we can still be reached 24 hours a day, 7 days a week, online at indot4u.com or by using our free INDOT mobile app. Thank you.
Thank you, Commissioner Mcginnis. Also ask Commissioner Carter from the Department of Corrections, who has made significant progress up in Miami County at the Miami Correctional Facility in terms of some PPE supplies.
Thank you, Governor. Rob Carter, Department of Corrections. When we first learned of the first case in Indiana, I got with my team, and we've got several facilities where we are able to manufacture things. We started looking at hand sanitizer, and then as the problem grew, I was brought into a conversation by Governor Holcomb with some hospital professionals here in Indiana to discuss the needs of the hospitals and just statewide needs of personal protection. The common theme that I heard was face shields, face masks, gowns, along with hand sanitizer and some other things. So I got with our correctional industries folks, and we've got a couple high-end sewing shops in a few of our facilities. And thankfully, some of the samples that we had donated from the hospitals are very helpful. So we got samples of gowns and the face masks. We were able to take those and reverse engineer some of the and made some prototypes. I brought them to a meeting. I brought the samples to a meeting and showed Dr. Box and my Chief Medical Officer, Dr. Kristen Doss. They made a few suggestions, and we went back with our team, and we were able to come up with a pretty nice solution. Today we're in full production of gowns. We're making about 200 a day. We may be able to scale up with that, depending on how much material we get. But Monday we'll be in full production of masks, approximately 200 a day, and we expect to have the material in today or Monday. So I've got some samples here I'll show to you. These are the masks. Now this isn't the actual material that we're going to be using, but we've got some hospital grade material that we've ordered that we should have in today or tomorrow, or today or Monday. And again, they're very high quality. Very proud of the guys for coming up with this face shield. This is the polypropylene material we're going to use to make the mask. This is hospital grade. A company called Mayer Fabrics out of Indianapolis, so it's an Indiana company. I'm not going to put this on, but this is the gown. This is actually material that we use to make pillows with, and it's waterproof. So they turned out pretty nice. Thank you.
Thank you, Commissioner. It's industrial strength. Appreciate that. Going to first responders so that they're not taking up valuable PPEs from the hospitals, et cetera. So this is truly taken note of challenges along the supply chain. Before I get to questions again, per usual, I want to send some shout outs to a lot of folks because the generosity continues to just pour out. The American Legion, actually the post that I'm a member of here locally, we have 14 members who are in that specific post who are either World War II or Korean veterans. And there is a process in place called buddy check. So everyone is checking in on all of the veterans, making sure that they have what they need, making sure if they need, if there's a grocery run, going through, again, World War II, going through Korean, they'll get up to Vietnam and just go through the whole ranks. It's a system that works. I know it's not just the American Legion. These are a lot of the veteran organizations, and it's happening all over the state of Indiana, as we've talked about almost daily, as the Commissioner just did, Rob Carter. I want to thank Hard Truth Distillery, who is also making hand sanitizer, and they're getting it into a 9-county area. This is an organization out of Nashville, Indiana. They're getting it to a 9-county area directly to first responders, including our conservation officers at the DNR. Everyone around the state of Indiana, if I've heard this once, I've heard it 100 times, and that is the number of people who are generously over-tipping. If you've got it and you can tip generously, please do. You're helping folks get through this all. I read a story in LaPorte at the Third Base Bar and Grill who had an order for $40 and got a $100 bill, and that's just kind of synonymous with what's happening organically just all over the state of Indiana. But it's making a huge difference when you walk into a restaurant, you buy a gift card for $1,000 and you say, I'm not going to use it right now, we're going to get through this, but this cash advance to you is going to go a long way to help you make, whether it's the light bill or rent or payroll. I also want to thank our mayors, who we remain in daily contact with, who are truly on, obviously, the front lines. They have stepped up in some incredible ways. You'll hear a fantastic announcement. Maybe it's going on now, but today down in Evansville, Indiana, Mayor Bob Courtney down in Madison, Indiana, has already put into place a cash or a city stimulus program for displaced workers. So they're hiring. Their intent is to hire about 100 people who have been displaced and put them to work right now through the storm. They're waiving building permit fees. They're doing away with contractor registration fees. They've launched a targeted kind of revitalization program, and they're doing that all right now during the storm. They've got a $2 million program, a grant program that's encouraging property owners to not just spruce up, but help eliminate blight. This is why we're going through this tough time. And it's mayors like Courtney and I mentioned Crown Point yesterday, and it just goes on and on and on. They are putting in motion rescue programs for small businesses, for employees right now, and they're doing it right now. So just eternally grateful for all of their leadership. Also want to thank, I see Brigadier General Lyles over here. I want to thank the Guard for so many things, but they're also partnering. I see Dr. Sullivan with FSSA and manning 6 food pantries around the state of Indiana: Maryville, Lafayette, Fort Wayne, Bloomington, and one here in Indianapolis. This is above and beyond duty, but we're in a new normal, and this is just what comes second nature. So thank you, General Lyles. And lastly, I would say I want to thank, there is a long list of Hoosiers with the last name Anonymous, Mr. or Mrs. Anonymous, that are just giving, and they simply want no recognition whatsoever other than to help see their community and their businesses make it through this storm. We're literally seeing envelopes with the name Anonymous on them show up, whether it be in businesses or churches. Just a tremendous source of pride for us all. We're on day 3 of Hunker Down Hoosiers, and I would also just say I have one ask on day 3, and that is that you, if you do, pray for our pastors. They too have been answering the call, and I have to believe that they are under a tremendous amount of strain dealing with the emotional. Dr. Sullivan talks about this as well every time we get together, just the emotional and spiritual strain as they're leading their flocks through this all. So pray for them. They're praying for you. Pray for them. They're a real source of hope and optimism, and we're becoming ever more reliant on their guidance as well. I was once told in a different venue that the true definition of an optimist is a poorly informed pessimist. I've never been a cynic. I'm not going to be a cynic. I am eternally optimistic, and but that also means you have to be a realist. And we are well informed, as Dr. Box has made sure you are as well, on a very daily basis. You just heard the numbers. You realize that we don't see the peak yet. These numbers are compounding, especially in certain areas. This is like a snowball that's rolling downhill and getting bigger and bigger and bigger. That's that community spread illustration. And make no mistake, when you look at that map on the Department of Health's website and you see big numbers jump out in central Indiana. Look over in east central Indiana also. This is all relative. This is urban, this is suburban, and this is rural. And if you don't think it's there, or if you don't think it's coming, we need to talk. It is. And we'll continue on a very regular basis to supply you with the information so that you're making the best decisions, because the behavioral changes that we're asking Hoosiers to make, it's nothing that we like. I wish it weren't so. But as my mom used to say, if wishes were horses, Eric, we'd all ride away. We're living in a real world here. And so it requires us to make some big changes. And I just want to thank every single Hoosier out there that is, in this instance, wanting to be part of the many, not the few. We are going to get through this together. We're going to be stronger for it together. I'll just say, and I'll be honest about this time, this is lastly I'll say, our OMB director, Chris Johnston, yesterday, we had a question about our surplus, our reserves. And as some budget directors are known to do, they can get very deep into the weeds and numbers and dazzle you with facts. But I just wanted to break down this whole notion of our reserves and our surplus and how meaningful it is for the state of Indiana and where we find ourselves. We've built a lot of bridges in the state of Indiana, new bridges in the state of Indiana over the last decade plus. We know how to do that, but this bridge to our recovery, I think, is the most important, and our surplus will play a critical role in us getting to the other side. When we think about that $2.3 billion surplus that Director Johnston mentioned yesterday, just factor in deferring our state income taxes to July 15th. Factor in deferring our property taxes. Understand that we've got to, we're going to close our books on June 30. And so that $2.3 billion surplus, we'll see, up to $1 billion of that before July 15th spent to get us to that other side. The good news is obviously that we're going to get some of that back when we start to collect that revenue, but that revenue is going to go way down. We spend about $1.4 billion a month, the state does, on Medicaid and schools and child welfare and public safety. So that surplus, thank goodness it is there to help us bridge this gap. The federal stimulus is going to help us get through this health crisis, this financial adverse impact that's coming from that, from the virus. We're going to have to deal with that. We have to deliver services on a month-in, month-out basis. And that surplus is going to help us do that as we ultimately beat back this virus. And I'll just say one more thing, lastly. You can't even spell virus without I and you, right? We need you. I'm going to do my part. She's going to do her part. We need the public en masse to do their part. And we'll continue to show you the proof, and we'll continue to deal with the outliers. This is too important. We cannot get this wrong. Thank you. Any questions?
Yes, question, Governor. Speaking of being well-informed and an informed public, so to make good decisions, have you seen the numbers about how many ICU beds we have in Indiana and how many ventilators?
I have. Dr. Box, you want to answer that to the legal extent?
What are those numbers that you've seen, sir?
We have to respect agreements that we have in place with the individual hospitals.
Then if you don't tell me the individual hospitals, can you go region by region or just for the state as a whole, so I can't identify which hospital, but I can at least do regions? We can look toward that. I want to make sure that we're not violating
any law or agreement with the hospitals. We'll look into the regions.
In a public health emergency, wouldn't
Absolutely.
an agreement like that be put aside or modified if you're asking the public to buy into the information you're giving them so they can make good decisions?
We'll make sure the public knows as we approach the surge that we do know is coming, and right now we know that we have the inventory to handle where we are today. When we get closer to those numbers spiking or closer to that peak, we'll keep the public informed of alternative measures that we may have to take. Hopefully we don't have to take those. Hopefully we manage it. That's why it's critically important that we practice social distancing. That's why it's important that we all play by the same rules.
Do you share Dr. Box's confidence that Indiana hospitals
We track it every day.
can double their ICU units?
We track it every day. This is one of the reasons why we move the elective procedures out of our surgical centers and our hospitals. Freed up beds, but we track them every day. This is why it's so important and relative if you find yourself in Hamilton County or Marion County or Miami County or St. Joe or Lake. We're tracking that daily.
And a doubling of the number of ICU units as the doctor has expressed appreciation.
We are good right now, but we will look towards supplying you with regional information that wouldn't compromise the agreement or the contract that we have in place with our hospitals. We'll do everything that we can to be transparent, absolutely.
Governor, or for Dr. Box, you talk about that snowball that's coming. What is the projection of how many will be infected, whether confirmed or not tested, once we get to that point that you're looking at?
That would be a number I can't give you in a best guess scenario. What I would say is that you're seeing these numbers increase dramatically, twofold. I think that we are having increased cases, but most importantly, we're testing more people. So we're identifying them. So we're still trying to figure out exactly where we are on that curve and what is that higher number that we would expect and that lower number that we would expect on any given day. And that's the projections that we look at.
Any idea when that peak would be? You don't know what the number would be. Do you know when the day would be?
We expect that peak to be coming sometime mid to late April.
Okay. And we've heard a lot about supplies being moved around. We're hearing that there are supplies in warehouse. The corrections department is making supplies. But we're also hearing directly from hospitals who are asking the public to give them supplies. So it kind of feels like 3 plus 3, then we're getting it's 4. So do we have enough supplies or do we not? Or how are they getting to the hospitals? How are they not?
No, there is no state in the United States that has enough supplies to do this the way we did it 6 months ago. We are all adapting to the supplies that we have with conserving, with sharing, and every single person that is out there, whether they work in a long-term care facility, an emergency room, a clinic, they are all working to conserve our supplies that we have. And those hospitals that need supplies reach out, and we are sharing with them what supplies we have.
Is it by demand? Like, how do you decide who gets what?
So we've divided that up based on a certain percentage to the hospital, a certain percentage to the local health departments because they have to supply EMS and also our long-term care facilities. And then as we get more supplies in or we get donations from people, certain hospitals are being very respectful of this. Hey, we got 12,000 masks from X, Y, or Z, so we're good for right now. And people are using masks for days at a time. I've mentioned several times, I've seen Dr. Sullivan, Dr. Weaver, my CMO, I've seen Dr. Kaufman, who's head of EMS. They have their N95 masks that they use to see people in the emergency room in a plastic bag in their briefcase when they walk around. So everybody's reusing and sharing.
last question and I'll go away. You talked about the Johnson County facility yesterday, and there's been lots of rollouts to long-term care facilities. Is there anything that happened with that when you guys had discussions about what we should and should not be doing?
And we had some great discussions with that facility and with the local health officer, local health department there, with the hospitals that were engaged with this. I would just say that we had seen their plan for COVID-19 and how they were going to address that, and I think they just needed that time period to actually be able to implement that. So we're really pleased, and it's already, I think, made it very real for all of our other long-term care facilities and our hospital systems. So we're working on specific guidance. In fact, one of the meetings I just left was working with long-term care representatives and with our hospital association. We want them as much as possible across the state to be able to work regionally to answer these issues. So if there's a critical access hospital that has beds that could actually help take care of these COVID-19 patients and their beds are not needed for that more acutely ill, that's what we want them to be able to do in partnership and collaboration. If, however, a hospital system is getting to the point where their beds are full, their ICUs are really becoming more full, then we need to have a place, an outlet, whether it's a wing, a floor, a separate long-term care facility that is dedicated to be able to house those COVID-19 patients.
I'd just add, don't go away. You're an important part of this all. We want our cup to runneth over in terms of supplies. We don't want the public or our hospitals, care centers, first responders to think that we're letting up. I mean, we're going to work every day trying to get as much supplies as we can. If we have too much, then we'll start talking about getting it out. But we don't want your local hospital, wherever you are in the state of Indiana, to think, we want you talking to them. And they will tell you, no, we're good on masks. We could use shields. That's what we're doing. But the public support, these sewing clubs that are cropping up all over the state of Indiana, it's working. Yes, sir.
Dr. Box, we've looked at the numbers, and thank you for that additional demographic information. What jumps out about those numbers to you? What do those numbers say about the situation? And secondly, the nursing homes that shouldn't have sent patients to the hospital, are they under any obligation to take those patients back?
So both very good questions. I'll address the nursing home question first. If an individual has been living within their facility, it would be our goal that that individual, when they're stable from a medical standpoint, to be able to return to that long-term care facility, potentially on a cohorted unit or a unit that is separate from the rest of the healthy patients. I will say that it's not common that if you have one person infected, that's the only person that's infected. So we have gone in specifically from an epidemiologic standpoint and looked at and tested other individuals to find out what is the extent of the issue in that facility. And when we start to be able to cohort patients on one wing or one floor of a system, then we can start to also conserve PPE within that system. With regards to the numbers, we saw that 52% were female and 48% were male. I wasn't expecting too much different there. 56% of individuals were 50 and older, and I think people may be surprised that they're not all 80 and over. But what I want to point out to you is that the 70 and 80-year-olds have been listening, and they've been kind of staying home and sequestered, partly because of the influenza outbreaks that we were having, partly because we were talking about COVID-19. They didn't have responsibilities and obligations to get out and take care of ill parents or young grandchildren. They didn't have jobs that they were going to. So they didn't have the exposure that some of our younger people did. So that's not an unusual thing. Again, it is going to be more of our elderly people with these chronic conditions that have more underlying serious problems.
Governor Holcomb, lots of the members of the public, several legislators, Dr. Myers, have all asked why is the state not releasing the information on hospitals, ICU beds that other states are already doing. The public doesn't know this. You're citing contracts. Why can't you? What can you explain that better? Why other states are able to do this and assure them of where they stand?
Yeah.
You know, yeah. You're the You're the one where making that final decision.
You want to talk about it from a hospital perspective?
So I think what's important to remember is that as you look at those numbers in other states, they may be giving you raw numbers. More importantly, a lot of times they're giving you percentages. And I think what you need to understand is that even when let's say we said we had this many ICU beds and we reached 99% of that, and everyone starts to get extremely excited and upset and worried about that, our hospital systems will be opening up other areas for ICUs. They will have other avenues, whether it's using general aisles, ventilators that they use in transportation or EMS, or whether that is now moving more med-surg patients off to another facility that we've opened up. All of those things are in the planning. And I can tell you that I have talked to many, many of our hospital systems regionally and individually as a hospital system, and they are very confident in their response to this situation.
And then another question for Dr. Box. You said you're anticipating a peak of late to mid-April. What leads you to make that projection?
We've looked at different modeling that's been used in New York, modeling that Fairbanks School of Public Health did for us, modeling that our own agencies between FSSA and ISDH are doing. And that's our best estimate. Again, we're already seeing some patients sick, but we're not seeing a big uptick in EMS calls for patients with respiratory illness. So I still think we're a little bit in the calm before the storm, but we know that that's coming and are preparing for that.
Governor, the president has criticized General Motors for their Kokomo plant not being able to churn out enough ventilators. What would you say about the Kokomo plant's ability to do that? And can you comment on the president's statement?
I applaud General Motors here in the state of Indiana. I've been in contact with them today. They're planning on moving forward, and I hope that they'll be able to help meet the need for the nation. And I'm proud that they'll do it in Kokomo, Indiana, in part.
And then a quick question for Dr. Box. Roughly how many people in Indiana have recovered from COVID-19?
We've been talking to my data team, and that is exactly what we're looking at. Again, those individuals who stayed home and just quarantined themselves because they were sick and didn't get tested because we had the limited resources, it's really, I'm never going to have a handle on that number, correct? Those individuals that may have gotten admitted to the hospital and then gotten discharged, that will be part of that data that we're collecting again, that when I have better codes in the system, I'll be able to better pull that information. But it is on the top of the list. I can tell you anecdotally, I know our first individual is out of isolation and doing extremely well. You know, there are people that we have kept, in touch with, and we know how they're doing. But I will tell you that even those healthy individuals that have weathered this kind of in isolation, whether in their own home or at another site, it's been a long process for them. It has not been something that they were better within about 7 days and felt, tremendously perfect.
Can you give a rough ballpark number, idea?
I really don't. I don't have that. I'm sorry. And that would be just what it is a best guess.
Governor Holcomb. I'll follow up with you, Dr. Box. So first question, of course, State Representative Terry Austin and Rita Fleming sent a letter to you today asking for an expansion for eligibility for the Healthy Indiana Plan. Is that something that you're considering or something that FSSA is trying to deal with?
Oh, well, they sent a letter to you, too. I haven't seen it yet. You saw it before I did. Everything's on the table. Healthy Indiana Plan is another 2.0 now. Another example of collaboration that works. We'll make sure that we're there for Hoosiers that need it the most, and this folks, again, but let me just stress something about the Healthy Indiana Plan. That, thank goodness it's in place, A. B, it's meant to be temporary. It's meant to help you get to the next rung up. So you betcha we're going to make sure that Hoosiers that find themselves in need in this extremely dark hour have an option like the Healthy Indiana Plan.
And then kind of a separate follow-up to that, based off of Dr. Box's comments about when we might actually see the peak, how likely is it that you extend the stay-at-home order?
We will if need be, but we track it daily. And we're in a 2-week period. We're on day 3. We'll let the numbers drive it. I don't have a crystal ball. All I know is what happened yesterday and the day before and the day before that and the day before that. And when you see it compound, when you see it double, not just, we're testing more for sure, so we know more. But when you see the positive cases double and when you see the deaths double, this is sobering every single day. And to know that that's coming tomorrow, that's the urgency about this all. And that's what we have control over ourselves. Yes, sir.
Governor Holcomb, Elder Ajabu, with WTHR Radio, 91.9 FM. First of all, I want to give accolades to the humanity that you showed by vetoing the renters' right bill. I think that does a lot for people here on the local level to see the humanity and the leadership that is being displayed at the highest levels of government here in Indiana. My question is, has there been any COVID-19 people to test positive in the Department of Corrections, especially the prisons?
I'm not going to speak on patient issues with employees, but I can tell you that none of our offenders are positive. So, and we, again, just like the governor said, we continue to monitor that every day and take all the necessary precautions and clean, make sure our places are clean. So,
if the employees have tested positive, and with the close proximity of people in the prisons, couldn't that very well make those prisons a death camp if the virus gets to spreading there? And I'm just asking, prisoners are humans just like everybody else. And our humanity should not stop at the doors of the prison, no matter what they have done. And so I'm just asking as a concerned citizen, how does humanity go beyond the prison door?
So I actually think that's an excellent question. And to that end, our strike teams that I've talked about that go into long-term care facilities that are now up to 6 across the state are actually going into jails, are going into DOC and investigating anybody that's ill and testing those that, are ill at that point in time. The advantage we have in the Department of Corrections is that those individuals don't move around as much, and we have a better ability to sequester them than we do even in our long-term care facilities and other areas. But there would be no difference in how I treat someone who's a resident of the Department of Corrections or a jail or a long-term care facility. The same testing, the same sequestering or isolation, the same treatment, the same when they get transferred to the hospital. That's no different.
Governor, are you considering release of prisoners?
We are not.
Thank you.
Thank you all very much.
Once again, thank you for joining us. Beginning Monday, press conferences will be moved virtually. We will do a test.
And you have been listening to the Friday update from Governor Holcomb and the State Health Commissioner today, and we learned a lot of important information in today's news conference. Among the things that we've learned today, according to the modeling and some of the projections that the State Health Commissioner has been able to do looking at the data across Indiana and comparing things with New York and some other studies, is that they do not think that the peak of the COVID-19 has hit here in Indiana. So here we sit on, the 27th of March, And the state health commissioner says that she believes that the peak is still coming sometime between mid and late April. So we here in Indiana, according to the projections, haven't seen the peak yet, that we would see the peak sometime here in the next several weeks. So that is sort of a startling thing to have to process today. Some of the other things that we learned in today's news conference, we're getting a better idea of the testing that is taking place across Indiana. We learned that there were 2,300 new tests that have taken place over the last 24 hours. So Indiana is seeing a lot more testing across the state. Unfortunately, our death toll has climbed by 7. We're now up to 24 deaths as a result of the coronavirus pandemic. And the governor said that while he doesn't have a crystal ball, he says this is like that we haven't seen the peak yet. It's like a snowball going down the hill, and it's getting bigger and bigger. There was another stress today on social distancing, this idea that we've talked about with you so many times in the past, keeping yourself within 6 feet of anyone else. We want you to obviously stay at home. This is day 3 of the governor's stay-at-home order, but if you have to go outside, take a walk, take your dog out for a little bit, have essential business, please continue that social distancing. This is going to help you, and it's going to help everybody else as we all work together to try to slow the spread. So again, one other thing that I wanted to pass along is we're looking at these numbers of who is testing positive for COVID-19. We learned today that 56% of the people here in Indiana who are testing positive are 50 years of age or older. So this isn't just the grandparents here that are getting this COVID-19. We're seeing people in their 50s, in their 60s, and in their 70s and 80s also getting COVID-19. So you've got roughly 44% of Indiana's population that is testing positive are younger than 50 years of age. So it's really important that we practice social distancing, continue washing our hands. Let's go ahead and do our part as we work together to slow the spread. We've got reporters working out. They're fanned out across the state today, working on a number of stories. We've got more coverage for you beginning tonight at 5 o'clock. For now, I'm Scott Swan. Let's go ahead and return you to regular programming.